32 questions, actually 4 quadrants of question. This episode of Ask Dr. Darwin, we're going to be talking to board-certified pediatric dentist, Dr. Trudy-Ann Frazer, and we're going to be learning a little bit more about her journey to becoming a dentist, what a typical day looks like for as a pediatric dentist, and some fun facts. So stay tuned. Hey, this is Dr. Darwin, your new dentist coach, with another episode of Ask Dr. Darwin on the New Dentist Podcast Show, where we talk about getting into dental school, becoming a dentist, getting into residency, and then life as a new dentist. Guys, be sure that you are staying all the way through this episode, but also sharing this content and liking and commenting as well. All of those things help us disseminate this information to your friends, your colleagues, and it's free. And there are ways that you can support us, all right? Look down in the link below. You can see there's ways that you can support us with merch, but also we're just sharing and adding value to this content. So comment, leave your comments down below. If you have any ideas that you want us to explore or topics you want us to explore, put those ideas also in your comments below as well. Also, this episode of Ask Dr. Darwin is being brought to you by GetIntoDentalResidency.com. GetIntoDentalResidency.com, the ultimate resource to help you become an advanced trained dentist, whether it's to become a pediatric dentist, an orthodontist, an endodontist, an oral surgeon, etc. So if you want to get some help in getting your application together and getting your interviews prepared for that big day, go ahead and look at the link down below. Get into dental residency in the link below, and we'll see you in the training soon. So today, 32 questions. This is a very fun way of learning a little bit more about our colleagues in the oral health profession. It's a very video series where we ask questions that highlight different dental specialties and focal areas within the profession to gain insight to life as a practicing dentist or oral health professional, or even a resident in training. So today, special guest, we're going to just jump right into it, Doc. So what's your name and where you're from?
Well, hello. I'm Trudy-Ann Frazer, and I'm originally from the best island in the world. I'm from Negril, Jamaica, and I grew up in Atlanta, in Stone Mountain, to be specific.
Gotcha. Now, what's your specialty area or focus in dentistry right now?
I am a pediatric dentist.
And how long have you been practicing as a board certified or board eligible pediatric dentist?
Yeah, so I've been a board certified pediatric dentist for 8 years and a practicing dentist for 10. Listen, next year, May makes 11. I can't believe it.
Wow. Yeah, the time goes by definitely fast, but it doesn't seem fast when you're an undergrad. So where did you do your undergrad, and what was your major as an undergrad student?
Yeah, so I did my undergraduate training at a small Christian school in Huntsville, Alabama, Oakwood University, and I did study biology.
Oakwood. I've had some previous residents, one of which we just talked about not too long ago, that did undergrad and studies at Oakwood, and also went to Meharry as well. So gotcha. Now where did you go to dental school?
You just told everybody.
I did.
I went to the Medical College.
Meharry Medical College.
The Meharry Medical College.
That's right.
That's right. Meharry.
The Meharry Medical College. That's where my uncle went also.
Oh, good.
Back in the late 60s and 70s.
I wasn't there, Dr. Darwin.
No, I wasn't. Actually, I was there. I actually went to his graduation. I have a picture.
Oh, wow.
I don't know, maybe 2 or 3. And I have a picture. My mom saved a picture of us at his graduation, him getting his cap and gown and hood and all that kind of stuff. Yep.
Oh, that's so cool.
It's cool, right? Yep. Now, before going to Meharry, did you go right into dental school from Oakwood, or did you do a gap year or anything like that?
I did. I think I have one of those traditional paths, and it was a blessing because God knew if I got distracted, I'd have been like, "Oh, I'm going to go work on the news somewhere." I I needed to go straight through, so I did high school to undergrad to dental school to residency, and then to work. So there was no gap yearing for me.
Right, right. Yeah, you're lucky. I know a lot of people want to do that, have that same intention and pathway. So that's good.
Mhm.
So speaking about dental school, what did you like most about your dental school experience?
I am a people person, which is likely the reason I went into peds. And I would say the best part of my dental school experience at Meharry was the relationships that I formed. I have a lot of mentors from Meharry, two in particular, Dr. Gerald Davis and Dr. Tawana Ware, who to this day I still talk to. They were intricate in my matriculation through dental school, and especially Dr. Ware. She was very hands-on, which likely attributed to me going straight from dental school to residency, because I remember junior year sitting in her office, her going, what schools, what's your top five? What are the application deadlines? Put this folder together. What is required? Put everything chart. I mean, she was ABC. She outlined everything for me. I knew when the interviews were. I had to go to her office with my interview outfit. She's like, okay, this is what you're wearing on this day. Let's do a mock interview. She did a mock interview for me. I mean, the lady had me, she had me together.
Yeah,
So I definitely think one of the best things for Meharry were those mentors who became more like, friends after graduating. And then a very good friend of mine who was actually a bridesmaid, Septian. Some of my other bridesmaids came to Meharry too, but I'd known them forever ago. But another good friend who practices as a general dentist, I met her at Meharry, and she'll call me if she has pedo questions. I'll call her if I have GP questions. So it worked well.
yeah. Well, that's the good part. That's the good thing. But we
Yeah.
all know there are some not so good things about dental school. So what was your least favorite part about dental school that you can remember?
I will start by saying this. You remember well, I'll say this. At Oakwood, what they taught us when the people who graduated came back to speak to our science club, they would always say that college is like a water hose, and you are taking in water from that hose and you taking most of it. But then when you get to graduate school, it's like a fire hydrant and somebody bursted it open. Look, I didn't want to say busted wide open, Doc. I didn't know how kosher I needed to be on your podcast. But
Yes,
you
we
literally
understand. We would have understood what you meant. We get it. Yes, that drinking of the water fountain, or
you
the
literally
of the
just
fire
stand in
hydrant,
front of the
fire
hose
hydrant. Yeah,
and you open your mouth and you just try to capture any and everything that they're throwing at you. So I would say probably my least favorite part of dental school was my inability to find some form of balance. Going in, I wanted to be an oral surgeon. So I knew I needed to, like my mom would say, be the best or be amongst the best.
hmm,
So I went in full force. I mean, I studied, and studied. Don't ask me anything about Nashville from my period at Meharry because I don't know. I looking back now, I'm 10 years removed. I could have and should have been more balanced, because I think I formulated some habits. And when real life hit, I wasn't able to really turn off the dental school discipline as much as I should. Because in dental school, a lot of times input equals output. But in life, you go through challenges. And I was like, why is this not working? Why is it not like school? If I study, if I do enough test questions, if I get enough of my study group together, things are supposed to click. But in life, that doesn't really translate. So I really wished I'd had a better balance in dental school. And it's hard to foster. I feel like most dental students don't really have a balance, because how can you balance the water just going all over?
yeah,
It's difficult. But I
yeah.
try not to
That's
live with regrets, because
yeah,
I wouldn't be where I am today without that imbalance. In essence, it sucks, but it is what it is.
yeah. Well, it sounds like that part of not necessarily having a full balance,
Mhm.
maybe one of the other things that made dental school hard for you. So what would you say was the hardest part about dental school? Was it still the inability to create and maintain a balance? And
Yeah.
if it is, or if it was something else, how did you overcome that? Because you had to get through
Yeah.
the 4 years, right?
For sure. So I would say the inability to maintain a balance. In all honesty, I think having a core study group is how I overcame it because I am the social butterfly. I'm on my report come that inability and that desire to have some kind of social outlet was in my over the material. And that's a habit I actually learned at Oakwood, that the sooner I'm able to review the material that was just discussed in class is the longer it's stuck and the faster it went into my long-term memory, because you hear it once and then you're just listening. If you're tired, look, hopefully you're able to listen to what the professor is saying. But we used to meet at least with one other of my study, and that enabled me to hear it again, so that during the week when it was time to go through it, it was like my third time hearing it. And then closer to the exam, now it's number 4 and number 5 time because I've gone through it before. So getting my study group together, they honestly gave me more structure.
Yeah,
And the social desire, the desire to talk to people. I couldn't sit there and talk to my books, Dr. Darwin. I would have
no,
gone crazy.
no, and it's
So we
part
were
of
able to talk it out.
yeah, and it's part of our personalities, or should be part of our personalities, things that we're
Yeah.
developing as we're talking to the people that we're going to be helping, right? It makes it
Yes,
a
I never
nice little
thought about that, but
transition.
absolutely.
Yeah.
Hmm.
So that was a great study hack, right? Having a study group to help you overcome some of the academic and also maybe just some personal challenges, some hard things about school to give you balance.
Yeah.
Getting that study group together. So for those of you that are listening and watching in dental school or getting ready to, find that core, find that core group.
Hmm.
Even if it's just one other person, you can add
Yeah.
people later on, but it starts with
Yeah.
a party of two, you and somebody else, right?
Hmm.
Party of two.
Absolutely.
Um, so speaking about dental school as well, as we wrap up this first quadrant of questions on the
Actually,
first.
can I add something
Oh,
there? Can
yeah,
I add something
yeah,
there, Doc?
yeah.
Sorry to interrupt you, but a thought came to my mind as you were speaking. Be flexible and be okay with pivoting, because the core study group that I started with freshman year is not the same core study group I ended with senior year. So being
Mm.
pliable, being flexible, being open-minded. The person I ended up studying with the most, I mean, we had our group, but some of us just gelled better than others. The things that she got, I didn't get. And the things that I got automatically, for some reason, she was like, can you explain that again? So being okay with, one, asking for help, and two, pivoting and saying, this is not working. Let me try something else.
Yeah, that's key. Got to be flexible
Mm-hmm.
um, during this process
Mm-hmm.
as well. So dental school, first day of school, did you have, I think you might have mentioned it, but I'm just going to ask it
Mm-hmm.
again. First day of school,
That's
did you have a specialty or area that you wanted to focus on or wanted to explore? I think you said it, but
Yeah,
you
I
said,
did. That's okay. We could revisit it. So I went into dentistry thinking I wanted an MD-DDS. I was going to be a board certified oral surgeon, 6 years postgraduate training. Doc, listen, I went on a mission trip to Jamaica, junior year, and I had to, and this is no shot against mission, like you're doing a service. So unfortunately, especially being in a third world country, a lot of times you're not afforded the opportunity for all the luxuries that we have here in a first world country. So I remember taking out a tooth on a lady and she had to spit in a cup. Like it was every time I elevated, of course, saliva was there, blood was there. She spat in a cup. Doc, I was so, it, I felt good. I felt like that desire to help was fulfilled. But when I say after that trip, I said, I do not like taking people's teeth out. Even to this day, when I have to take out my pediatric patients' kids' teeth, because that's what they're afraid of. You're going to pull my tooth. I even tell them I'm not going to pull on it. I'm going to hug it really tight and I'm going to wiggle on it. I have to make it this big theatrics because people are scared of getting their teeth pulled. And I realized very quickly after coming back and doing that and then going into the oral surgery rotation, I don't like doing this.
Right.
So I had to pivot.
Yeah. Were there other specialties besides oral surgery that that you knew that you did not want to explore?
Yeah. So this is where I'll bring in that mantra of mine that you don't know what you don't know.
Mm,
I thought ortho was like, it's boring. I don't know. I think it's the orthodontist's best kept secret. They don't, no offense to any orthodontists listening. I have some very good friends that are orthodontists, but I think they purposely really don't teach ortho in dental school. They're like, nah, if they know, they know. It's the best kept secret. If they know, they know.
yeah.
But I thought
Yeah.
ortho was so boring. A good friend of mine, Jamish, we were neighbors in dental school.
Okay.
And I think we were only neighbors for a year. Jamish ended up going to ortho at Howard. And I remember the last week of dental school for her, I was like, what are you going to do? Ortho. Why? And she looked at me, she was like, you'll see. To this day, I see Jamisha and I go to the same church and I see her. I refer her patients now, and she's like, mm-hmm. So
Right.
you don't know what you don't know. And I tell my patients now that are going off to college or dental students when I talk to them, have an open mind because I wasn't going to say this, but I'll let the cat out of the bag. About 3 years into pedo was so hard for me, especially my first couple of years. I had to unlearn some of the habits that I learned in dental school. Dr. Darwin, I don't think it's, I asked you how honest you want me to be, and I feel it. I'll be vulnerable. I don't think it's natural for us to think in 1 millimeter increments. I think most people that end up in higher education, dentistry, medicine, those careers that require such intricate details that small mistakes have drastic impacts, that 1 millimeter practice that we have. Now, mind you, when you're in a patient's mouth, by all means, do the best that you can, but it just doesn't translate to life. And I think and I'm a recovering control freak, and it just does not serve you. You can't control the patients, you can't control the kids. Look, bring me back on track. Where were we headed? What was the question? Tell me.
We're talking about the specialty that you knew that you did not want to
There we
explore.
go. You don't know what you don't know. I actually went back after 3 years of practicing peds. I applied to go to ortho. And I do believe it's an act of God. All respect to other religions and what people practice and believe, but I believe in God. And I honestly believe it was an act of God that I did not match because I had like 5 or 6 interviews. And at the end of everything, I was like, I'm not feeling this. Something is off. And I was in a tough space in my life. I was going through a divorce then. And I defaulted to what I knew. I knew how to do school. So I said, I'm unhappy at work. I'm unhappy in marriage. Let me figure out what it is I do know how to do. Pedo is driving me crazy. Let me go do ortho, right? Look, I don't think I have ever told Jamish that. She would laugh. But yeah, I'm thankful I didn't match Dr. Darwin because what I needed wasn't another specialty. What I needed wasn't another letter behind my name. What I needed was peace.
Yeah. Yeah. And you found peace in pedo.
Ooh, I found peace through therapy.
Okay.
Mm-hmm.
Therapy matters.
Something,
It helps.
right. Something I was talking to my brother about this interview. I told him, I said, I'm gonna be honest. Um, I think how you show up in life and who you are as a person is who you are as a dentist. Like Darren Hayes is Darren Hayes. Of course, you're more professional at work. Of course, I'm more professional at work. But the things I struggle with, that's who I am as a person. So I believe that we honestly should seek out personal growth and development just as much, if not more, that we seek professional training. Like it's one thing to be a dentist and to know how to cut on teeth, but you and I both know, Doc, that we're not working on typodonts. We're working on people with personalities,
Right.
with baggage, with fears. And I believe that, and what I know to be true is the more you develop in your personal life, and the more, sometimes it's getting a coach, sometimes it's reading books. If, you may not be able to afford coaching or therapy right now, but even, little books or YouTube channel or listening to you and learning life lessons helps you to develop as a person, and you end up with a more fulfilled career. No matter what specialty you pursue, you're going to show up as yourself.
Yep. Yep. And
So I
people
think
will
this
see
is
that.
important.
Yeah, that is
Absolutely.
important. And people will see that both sides. And you are, you're a person, but you're a person who's a professional, and you're a
Yeah,
person who also has a personality. So you're right. That personal development is key, right?
absolutely.
That helps us go through the process of
Hmm.
life.
That's right.
Go through the process of life. So life as a pediatric dentist. Let's talk about that. We're going to go to the second quadrant here. What made you fall in love with pediatric dentistry?
Well, it started in dental school with my mentors. I think I talked about Tawana Ware. Dr. Ware was just so hands-on. And when I was in the pedo clinic, I felt alive. I felt like I could be fun. To this day, I still wear Wonder Woman. I should have showed up in my Wonder Woman shirt with my cape. I wear that to work. I just feel like I can be my authentic self in a pediatric setting. And when I was in dental school, when I went to the adult clinic, I was like, good morning. And the patients were like, you want me to open? It was just boring. When I went to the pediatric clinic, the kids were so alive. Yeah, they were afraid, but at least I could get to down to their level. And they were so impressionable. I can make a lasting impact. So I love the fun and of pedo and how impressionable. I wanted to make that impact on an early stage on a child's life. So I love that.
Yeah. So for those that are considering pedo, just tell us how long is training to become a board certified pediatric dentist, including any, you know, fellowships or maybe special research opportunities that maybe some pediatric dentists may want to pursue, or they actually will do as part of their training as well.
Yeah, so pediatric training is on average 2 years post dental school training, or some programs are 3 years. And that's to become a pediatric dentist, to get your certificate. I do know a couple pediatric dentists that furthered their career and did a fellowship in special needs dentistry. And I remember, I think it's Jacoby Hospital, is a hospital in the Bronx, actually afforded that special needs training. So you can either do it. I think one girl did it before she got into pedo. So she
Yes.
did it between dental school and residency. But I know one other person that did it after. So it's almost like a fellowship. I think it's a year in special needs dentistry, where you really hone in on those patients that have those special needs, and special train, just the little voom that they need. They need a little bit more. So
Yeah. Yeah. And that's so hard to find. Many states, there's not a lot of resources or access points for those individuals that have developmental disabilities, and
absolutely.
finding those providers that actually offer services or can accommodate can be a struggle for many
Absolutely.
families as well. What do you think is the most unique part about pediatric dentistry? What makes pedo unique outside of
Well, I
other
would say,
specialties?
right. Um, I'll give a disclaimer. You remember the statement that I made earlier? You don't know what you don't know. I don't have training in other specialties. And there are a couple things that makes pediatric dentistry unique. But I think the one thing I want to highlight is that you actually have two patients in pedo. I don't think there are many other specialties, and I could be wrong, but I can't think of one where you have two
Ooh,
patients.
two
And let me tell you why.
patients. Yeah, tell us
Mhm.
why. Yeah, I got to hear this.
You have the child and you have their parent. So not only do you need to focus on that child psychology, and you need to meet them where they are, because those kids show up with with baggage, whether they're 2 or 4 or 5. Somebody told them something. I had a kid that told me that Johnny in her class told her that I yanked teeth out. I said, well, am I Johnny's dentist? She said, no. So, being quick on your toes and figuring out how to connect with this child and what it is that they're afraid of and getting them to talk to you is a thing. And then the parent psychology. I think there's research that shows that maternal fear gets transferred to that child. So things like, oh my God, you're going to give him a shot? Well, if mom is afraid, of course I'm afraid because my mom is my hero. Or learning how to separate the child from the parent and gaining that parental trust. I had a kid last week. She's like 8 or 9. I've done a ton of fillings on her. But this time I walk in the room and she's in her mom's lap, clinging to her. But thankfully I have that trust with that mom. So I got her to stand outside of the room. And then we started talking about Thanksgiving, just completely distract her, put the nitrous on her nose as we talk. So you have 2 patients. So figuring out what is needed and doing it quickly, because you only have a short period of time to figure this thing out. And I don't always have it right, Dr. Darwin, but I think the longer I do it is the most effective and efficient I become.
Yeah, that's great. Enjoying it. First thing I want to ask is, did you know that a large majority of the individuals like you who watch these episodes are not subscribed to the channel, to the YouTube channel? Nevertheless, we want to say thank you for watching and continuing to share these videos and episodes with others. Next, I want to say is subscribe. Yes, please hit the subscribe button so that you get these notifications each time these episodes are released. Last is I wanted to connect with those of you who are seeking to become an advanced dentist and specialist. And I invite you to our next event called the Get Into Dental Residency Challenge. This is a special 4-day event that will give you direct access to the mistakes that you want to avoid when you're applying to residency programs, and also the 8 steps that you also want to avoid so that you do not have an unsuccessful application submission. The information that we will be covering over those 4 days will be some of the tips and strategies that I teach in my one-on-one and group coaching trainings with clients who are continually and successfully being matched into and selected into high-profile residency programs here in North America. So if you're pursuing or aspiring to get into dental residency this application cycle, this challenge is for you. Check out the link below to receive more details and join the challenge. And also, I would encourage you to enroll in the challenge via the VIP experience. The VIP experience gives you actually access to a 1-hour Q&A session every day of the challenge before we actually get started with the challenge. And it guarantees me to answer your specific questions that you and other VIP experience members have on a daily basis. So I'll see you in the Get Into Dental Residency Challenge, and let's get back to this episode. Yeah, that's great. So why should someone consider PEDO or choose PEDO to become a pediatric dentist?
So that's a very good question. And it's a personal choice. But I do think we do need more dentists that are willing to create a generation of kids that enjoy coming to the dentist, which in turn creates a generation of adults that enjoy coming to the dentist. So the dental disease in the population would be reduced. I think that's the best answer I have because it's such a personal preference. I think we're going to talk about it later because pediatric dentistry will teach you patience.
How to be
people,
patient with the patient.
How to be patient first with yourself and give yourself grace, but also to be patient with the patient, with your staff, which I think that's independent of PEDO. That's just life. I guess it's just life, huh? But God created me. I believe he created me as a pediatric dentist to save my I tell you, I'm a recovering control freak. I used to get so pent up and frustrated when patients came late, because now the whole schedule is thrown off. When I couldn't get this 2-year-old to stop screaming. Now I've kind of learned to reframe things and realizing that the only thing I can control is myself and how I react to these things. And then I think protecting my ears. I get those clear earbuds. I try not to get the yellow construction worker ones. I get the clear earplugs, the ones that you use in concert, so it filters the sound so you can still hear when the parent's talking or when the assistant's talking, but it protects my hearing. So I wear that when I know I'm going into a case, either where I have to use a drill or the handpiece. Look. Or I know I'm gonna have a screaming kid. Once that kid is on the 3, I'm putting those earplugs in. Reframing my thought. And I tell the parents too, they're screaming because they're not mature enough to say, Dr. Frazer, I don't really like this. They're saying, I hate this. I don't want you in my mouth. So just reframing your thought and how you perceive things has helped me a whole lot. And it's given me a reduction in my stress level. Hence, I'm able to actually enjoy things more.
Yeah. Yeah, that makes sense. Well, let's flip it. Let's flip it. Why should someone not choose PEDO?
Okay. I'll be honest. I don't think somebody should choose PEDO because they believe that pediatric dentists are the richest, right up there with oral surgeons.
Right.
Because if you chase money, Dr. Darwin, you'll never have enough. And if you go into a specialty for the wrong reason, you will be weaned out. The stressors of the specialty will eventually wear you out and you will quit.
What else? What are some other reasons a person should not consider PEDO? If they have
You
these
don't want to
other
work with
qualities
kids.
or characteristics or something.
Oh, right there. If you don't want to work with kids, he was like, that's a general answer. If
No,
you don't want to work with kids,
that's
like
key. That's very
the
key.
majority of my patients on a day-to-day basis are under the age of 10. So if you feel like you bond better with adults and you just want a more mature patient, one where you don't have to necessarily repeat yourself, which I don't know. Some of my GP friends are like, I should have done PEDO. My adults cry and I can't figure out how to get them to stop crying. But I mean, the majority of my patients are kids. So the obvious one, if you don't want to work with kids, if you're afraid to get bit,
Right.
and if you don't want to be pliable and flexible, I mean, kids really will have you doing backflips in the operatory. So if it's something where you feel like, you know what, I just do not have a patient personality and I'm not willing to develop a more patient personality, I don't think you should do PEDO. If you with having the parent around and you're not willing to learn it, because a lot of these skills are learned. If you're not willing to learn about the psychology of people, the psychology of children, I don't think PEDS is a good one. And if you're not willing to really go through some things sometimes, like sometimes we have challenging cases, you're not going to be able to put every child to sleep. The misconception is if they're uncooperative, I can just put them to sleep. But there's so many factors that come into play. The child's health, sometimes they're not healthy enough. Sometimes the parent's desire, sometimes it's finances. We work in an office that's predominantly insurance or fee for service, and we don't do sedation in our office. I know that's very rare. Our demographic, we have a very heavy hygiene office. So the ones that need sedation, we have to refer them out. And sometimes the parents are like, I can't afford that, or I'm not doing that. So if you're not willing to really be patient with yourself, be patient with the parents and the kid, and really figure out how to pivot, I don't think PEDO would be a good suit for you unless you're willing to learn.
Yeah. Patience matters. Patience matters. Stereotypes. Are there any stereotypes about pediatric dentists?
I laugh because I didn't realize I had a stereotype. I actually met a lady that was a pediatric dentist recently, and most of the pediatric dentists that I meet are big personality, they're fun, they're in your face. But Dr. Darwin, she was like calm, cool, and collected. And I was like, that she speaks very monotone. But you know what? she figured it out. Maybe when she gets in her pedo realm, she turns it on. But I think a stereotype is that pediatric dentists are like big personalities, and there are quite a bit of them out there that are really not, because not every child needs that big personality. Some of them need you to just be calm and cool so that they can just kind of chill and relax. So I think that's a stereotype for peds.
Yeah, and I think you have to kind of match the personality
Yes.
and the emotion or lack
Yes.
thereof of the person, the child, and or the parent, right? So you have to
And
be
the
able
parent.
to kind of work through
Yeah.
that. So that means
Right.
that some of so there could be a stereotype about pediatric dentists, and some of it could be true, and some of it is not true, right? Not all of we are big kids themselves, but some are, right?
Some of them are. My
Some of
husband
them
just sent
are.
me a guy, I don't know his name, but he has like a shoe closet in his office. Like he wears sneakers and t-shirts,
Yeah,
and the kids get to see his sneakers. I love it. I told you I
yeah,
wear a cape. So I guess he and
yeah,
I fit the stereotypical big personality. But I will say this, when I don't feel like it's what's suitable for the environment in that moment, like whether there's sadness or the kid is just terrified, I can calm down. It's a common misconception that voice control is loud and boisterous, but voice control is calm and quiet. And that's a little tactic that I have. That's a free one for the ones that are either in residency now. Like sometimes actually coming down to the patient's eye level and speaking to them very calmly and slowly, and they're like and start whispering. They're like,
right.
that's a form of voice control, and it gets their attention likely better than the yelling because maybe they're accustomed to the yelling.
Yeah, and maybe they're so accustomed that they're afraid of the yelling because the yelling also means something else,
Right.
right?
So
That you're in
that's a
trouble.
freebie. That's a freebie.
Yeah, yeah. Well, it's a freebie that can cost you a lot if you don't understand it, right? If you don't understand that dynamic, it can cost you chair side, and also not really being able to help the family or the individual the way that you want to, right? Because if you
Hmm.
can't relate to them, like you said, the parent be like,
Yeah.
well, no, I'm not doing that. I'm good. I'm
Hmm.
good. And
Right.
but that's important. Third quadrant of questions, diving deeper into pedo. So what's your typical or average day look like? Your average day.
And I love practicing with more than one doctor, especially when you first come out. When I first came out, I was by myself in the first three offices. Um, But at this office, it's flip-flop of a schedule. So on Mondays and Wednesdays, I see nothing but hygiene patients. We have three hygienists and we have a block schedule. So each hygienist sees about two to three patients every hour. And I do the exams or something really quick, like if they need something removed, like I'm not doing any treatment. And then on Tuesdays and Thursdays, those are my operative days. So we have a block schedule there too, where I have a large operative procedure. So maybe large fillings, crowns, 1 to 2 quadrant of dentistry, and then a small 30-minute appointment. So maybe some sealants and a filling, something small. So we do that. And I love it, Dr. Darwin, because it reduces my risk of burnout because I'm less stressed and I'm able to focus. So I'm not jumping from hygiene to op, from hygiene to op. And the patients actually have a better experience because they're not waiting for, I would say if they're waiting for 7 to 8 minutes, that's a rarity because I have the availability to go to the next patient and not be stuck during treatment.
Yeah, that's key. Hopefully you all are listening like very in tune with what Dr. Frazer just mentioned, which is she said two key things that I thought that I took away in quadrant dentistry, ways to ensure that you're working efficiently and effectively, and that's not only for you as a practitioner, but also for
Mhm.
the people that you're serving, right? They
Yeah.
you know how long it's going to take you to do each of your procedures and then also your treatment plan, because you have a process that's incorporated into how you're delivering care. So I just wanted to note that as an effective way to make sure, like you said, that you're being efficient, you're using everyone's time in the right manner, but also so that you don't burn out, like you said, or make sure that it's predictable, but also it's still fun, so that you're not having a lot of, like you said, roller skating in the office.
Right. And Dr. Darwin, I hope we have time, because I want to talk a little bit about burnout towards the end of our interview, because I do think that's so important.
Yeah. What would you say is the hardest or most challenging procedure that you have completed or you're working on, that you have worked on as a pediatric dentist?
So I interpreted that question a little differently, because in peds, the procedures themselves aren't necessarily difficult. Now, I will say this, and don't judge me, because somebody's going to say, well, that's why she didn't become an oral surgeon. I have had some second molars, some primary second molars. So that's A, J, K, and T, kick my butt.
And why?
I will say that.
And why would you say that? Why? What about those particular cases made it hard?
You're such a teacher. I love that. I love that. You're such a teacher. So those teeth have thinner roots. And if you remember from your dental school anatomy, the roots of those second molars wrap around the crown of the permanent premolars. And sometimes they're ankylosed, or sometimes they're just fused, and they're so thin that you think you're going to break the root. But the key to that is to elevate. Listen, I don't even pick up my forceps until that tooth is in there dancing like this. That was a dental move. I don't pick, because I know if I do, the roots are gonna fracture. And if it's a small amount of root that's there, just leave it, because you going in to elevate that, you may end up pushing the permanent tooth away and then causing a different problem. So it's almost best that if it's not easy, if the roots of the primary teeth aren't easily retrieved, then it's best to actually leave it, inform the parent or the guardian, and take an x-ray so that you can document it, because that tooth in the future, it may get pushed out by the permanent tooth and you can just take it off, or it may get resorbed by the body depending on how big it is. So that is one thing. But I would say most of our procedures aren't challenging. The patient behavior, the behavior management, I would say, is what makes pedo hard. Because if it's a small, I don't know, buccal resin on 30, but there's an operculum there, so there's lots of blood, lots of bleeding, you're having a hard time isolating, and then your target is moving like this. It's more so the behavior management that's hard with pedo, not necessarily a lot of our procedures.
Yeah. In your practice setting where you are now, what would you say is your most routine or most common procedure?
Well, we have a heavy hygiene office. So we do a lot of hygiene, but in terms of operative procedures, I would say fillings and stainless steel crowns, pulpotomies, your basic operative pedo procedures, fillings, pulpotomies, crowns. Yeah.
Okay. Any very memorable procedures or treatment plans that you participated in or comprised, that once you had it done, it gave you like one of the best feelings as a dentist or as a provider? Any memorable cases like that?
Yeah. I lecture, and she's in one of my lectures. There was a young lady who had the sweetest spirit, and she just was really cognizant of her smile. And I was able to do some cosmetic procedures on her front teeth, and the level of gratitude that she expressed. She was actually being bullied, and she was like, oh my gosh, I can smile again. And she was, you always know that a patient, or even a like adult or a kid, is insecure about their smile when they laugh like this and they cover their mouth. And I literally watched her when she first walked in, just very subdued aura. She looked down, she didn't make any eye contact, and it was because of her front teeth. And when we fixed them, that was the first time I've ever seen her smile from canine to canine. I may have even seen some premolars in there. I mean, Dr. So I remember her, and I think we changed her life that day.
Absolutely. And I bet you if you were able to document her, how she was emotionally and how she presented visually with this and heads down
Yeah.
or looking
Yep.
away as a before, and then doing the same thing as an after, that in itself
Yes.
is probably one of those things that, explains how that can give you the greatest feeling as someone who's
Mm-hmm.
helping transform
Right.
someone's smile, but also transform their life, right? So
Right.
again, another reason
Mhm.
why oral health matters, you guys, right? The transformations that go on that affect not only intraorally, but also spiritually and emotionally as well,
Yeah.
you know? What's the toughest part, do you think, of being a pediatric dentist, being a leader in the office and a member of the pedo community? Pedo community. What's the toughest part about your role and position as such?
Yeah. I don't think it is independent to or specific, right? It's not pedo specific. I think it's people specific, is managing people. And in dental school used to say it like the dentistry is easy, mind you. We're just learning how to cut class ones, and they're like the dentistry is easy, and we're like, but we don't know how to do this part. But it honestly is managing people, managing the patient's behavior, managing the parent's expectation, managing your staff. Um, I'm not an owner right now, but we have the most incredible front office staff and management in the office. That is honestly another part of why I think I enjoy practicing not just as a solo practitioner, because all the questions don't come to me anymore. My boss is there, her office, who's the business manager, her husband, who's a business manager, he's there. So it takes a lot of the pressure off of me, and I'm able to focus more on the dentistry. There's a give and take with that, right? Some people are like, well, it's so much more autonomy when you're able to practice as a owner, but everybody has to figure out what works for them.
Yeah.
But yeah, the people part is the most challenging part, I would say.
And that's why a team matters, right?
Yes.
Work. There's an African proverb. If you work, if you want to go fast, work by yourself. But if you want to go far, work with others or have a team of people that you work with, right? And those types of environments, again, everything's not for everybody. Everybody's not for everything. You have to find
Yeah.
your niche within the niche to see what works best,
Mhm.
for you. So that's good that you
Mhm.
have found that as well.
Right.
And
And
with that,
Dr. Darwin,
yeah,
I'll add to that before you move on. Somebody's listening and like, well, what if I don't know what my niche is? Or what if I don't know what my team looks like? Once again, give yourself grace, because it wasn't until I started to really practice. And I think I said I'm at year 10, and it's not independent to dentistry. My husband, I almost said my fiance, my husband is a lawyer, and we were talking with another lady who just crossed the 10-year threshold in practicing law. And she said, I really didn't find my groove. I didn't find my niche. I couldn't figure out what it is that I liked and didn't like until about year 8 to 10. So I think people listening, I think in dentistry specific, we're used to instant gratification because you're in pain, I fix the pain. You have a cavity, I fix the cavity. It's not a six to most procedures, I would say, is not prolonged like in other fields like medicine. In dentistry, though, it takes us a while to find our niche. So for a lot, I feel like a lot of new docs listen to your podcast and watch your YouTube. I think just giving yourself grace and asking for help and reaching out and finding mentorships and listening to tidbits and gems and tools like this. I wish podcasts were as prominent when I was in dental schools as they are now, because people are here dropping gems that can really help you hone your craft. So yeah, getting a coach. Doctor, aren't you a coach?
I am a coach. I'm a friend. I'm a dad. I'm a son. All of that. I'm
I
a
love
teacher.
it.
I'm a listener. I'm a leader. All of that. And one of the things that I heard that I liked was asking for help.
Absolutely.
And being all those things and having all those roles that we have and hats that we have doesn't make any we're not useful in helping others if we don't ask for help ourselves. Right.
Mm-hmm.
So I'm glad you shared that, of the whole notion of asking for help. The smartest dentist, pre-dental student, dental student, or doc in the room is the one that asks for help, because we don't know everything.
That's right.
And if we did, we would be on an island by ourselves where we didn't need anybody because we knew everything. And that's not reality, right?
Yeah.
What would you say so far has been the most rewarding part about what you do as a dentist, or as a pediatric dentist more specifically?
I I'm an empath. So I would say probably the most rewarding thing about my work is finding fulfillment when I see patients evolve. So I gave you the example earlier, which makes sense now why that's the most memorable thing that I that comes to mind. Like, I watched that young lady's affect change. I won't say it was just me. I'm sure she's doing some work outside of just her teeth. But when you change a child's life at such a young age, I think you change the trajectory of their life. Like, imagine someone that is a 50-year-old lady that doesn't know her worth, doesn't see her value, doesn't pour into herself, and has a low self-esteem or self-confidence. She likely did not pursue jobs or relationships or opportunities or experiences that she could have had. Whatever, for whatever reason, somebody came into her life and she either did the work or allowed them to help her change that. And a lot of times these young kids, they're still trying to find themselves. I see myself, especially in I love all my patients, but when I see a young Black girl walk in that room and I see myself in her, I pour. And when I watch them develop and grow, I literally have watched some of these kids. Like, as adults, we change, but a 4-year-old looks a lot different from a 10-year-old. And when they come back and they say, Dr. Frazer, you spoke life into me, or Dr. Frazer, I knew you could do it. I knew I could do it because you told me I could. Just the effect that I'm having on the lives of my patients, the ones that would listen, because I've also learned that I am green tea and some people need coffee. So I can't change everyone's life, but the ones that I feel like they're willing to learn and we can really bond and vibe, I see such a great change, and I love that. And it just pours into that empath part of Trudy. So I love it.
And that's key. What you mentioned is key, because we don't know what the impact is that we have on individuals, kids or adults, adolescents or adults. We don't know.
Yeah.
And many a times they see us as the example, or as an example that embeds within their fiber or their personality, or something that provides a positive spark as it relates to maybe how they can behave, or what they can pursue as a profession or as a career, or something that you did, a story or a fact that you shared that impacts them. Lots of times we don't know until later on, right?
Yeah.
I've talked to many
Uh,
of our colleagues, especially those that are pursuing dentistry as a career, or even those that
mhm,
are pursuing specialties. And one of the things that comes up very often is that spark, that person,
mhm,
that dentist when they were a kid, or that
yeah.
individual, that orthodontist when they were 13 years old, and having that experience and what that meant to
Mhm.
them, and how that shaped or helped to navigate a certain part of their life, or change their pathway. So we don't know.
That's right. That's right. And
We
to
don't
add to
know.
that, Dr. Darwin, it's not, once again, I guess I'm dropping a lot of non-pedo specific gems today, but it's not pedo specific. People want to be seen, heard, and understood. And when you walk into a room, any room, whether it's at work or outside, and somebody feels validated, they feel like I was seen, that person gets me. A lot of times that breaks down so many barriers. It breaks down socioeconomic barriers. It breaks down judgment. People are more willing to be vulnerable. And when, in our case, we're talking about dentistry, when we're rendering treatment and our patients feel like we see them, we don't see teeth, but we see them. Or we write in a chart, another gem, you write in the chart, patient is going through pageant. I have a kid that I heard last week is running in the Junior Olympics, patient running the 400 and the Junior Olympics. Like, they want to feel, in essence, just like they're human. And we just don't see, what do you call it, 1 through 32 teeth. So a lot of times you'll be able to give them what they need because they feel seen by you. Isn't there a saying that says, before they want to know what you can do for them, or before, I'm butchering this, but before they want to know that you care before they want to know what you know. But when we
My
talk over our patients' heads and we hoity-toity, I know everything, it gives this air of you're better than me and I'm not good enough. But when you meet patients or parents, in my case, where they are, the trust factor is built. And when that trust factor is built and you have, in essence, developed a sense of teamwork, man, I recommend some stuff sometimes. And the staff is like, I can't believe they're letting you do that. They didn't let anybody do that. You're like their fifth dentist, their fifth second opinion. How you got 5 second opinions? But because they feel like I heard them. I saw
yeah,
them. I'm meeting a need, that emotional need. That's why we deal with people. We don't deal with teeth. If we dealt with teeth, we'll be working on typodonts all day or working in a lab somewhere.
right.
So that's just a gem.
Yeah, yeah, and you're right. People don't care how much you know until they know how much you care.
I told you I butchered it. That's it.
That's all right. Maya Angelou. I think that was her. And that's true, right?
Yeah.
Right? They don't care that you are number one in your class, or you're number 100 in your class.
Yeah.
That's not important. What's
Yeah.
important to them is how you treat them,
That's
how
right.
you made them
And when
feel.
and when mistakes happen, which I have had one happen, it's not the assistant's fault, it's my fault.
Yeah.
Um, she I won't get into details. It's my fault because I'm the doctor. But I took out the wrong tooth. Thankfully, it was a primary tooth. And I developed such a rapport and I didn't hide anything. I told a parent. They were like, Dr. Frazer, since you've been treating us, you have been nothing but honest and open and direct. And I tell the parents too, do you need me to sugarcoat what I'm going to say? You want me to shoot straight? 9 times out of 10, they tell me to shoot straight. But some of them are like, Doc, just be gentle with me, But having these conversations over the years develops that trust. And I took out the wrong tooth and I was honest and we figured it out. Like I said, it was a primary tooth. So in my case, I had less repercussions than had it been like a number 8 or something.
Yeah. And
But
it happens.
yeah,
Like you
like
said, it happens.
it happens. But when you don't have that air of perfectionist, the patients trust you.
Yeah. Well, we're going to keep it moving, getting into now lifestyle and some fun facts and things like that, as it relates to being a board certified pediatric dentist. How many hours do you work a week typically? What's
So
your
I work 4 days. Our office is open Monday through Thursday. So that's 32, work 8 hours. and we're open. Mondays is our late days, so we go 9 to 5 Mondays, and then Tuesday through Thursday we go 8 to 4.
Gotcha. Gotcha. What's your sleep pattern like? How many hours a night do you sleep?
In need for improvement, sir. So right now I'm getting about 6.5 to 7, but my key is 8, and I just need to prioritize sleep. I need to take
Yeah.
off the daggone social media and go to sleep.
Yeah,
I do need
good
8.
luck with that. Good luck with that.
Oh no, I'm gonna figure it out. I don't have a choice. I'm doing too many things. I'm a coach. I don't have a choice. I was like, I'm gonna really burn out.
Yeah. Well, it's passion projects. And when you're passionate about your projects, sometimes you will pass on some things like food and sleep and self-care, right? But you got to balance and put it all in. That's important.
Yeah.
Also balance in the office. Do you all take call or have after hours with emergencies or anything like that? Is that part of your
You mean this call phone right here?
Well, I guess so. So yes, you do take call. You have
Thankfully,
call.
I do. My boss and I do 1 week on, 1 week off. So this week was and it includes the weekends. So this week was my week. But thankfully, our parents are very respectful. They're not calling us for things that aren't really true emergency. And if they do, it's just walking them through it. I don't really have to go into the office.
Yeah.
Knock on everything in this
Yeah.
room.
Yeah.
I
Let's
don't
knock
really have to
on
go
it.
into the office for much. So yeah, our calls are usually things that we can walk the parents through, at least to manage it for that night, and then we can have them come in the morning if it's urgent. Unless, of course, it's a permanent tooth that came out, an avulsed permanent tooth, then you want to get in the office within that hour.
Yeah.
So
Yeah. So
thankfully, we don't have a whole lot of those. Our patients wear their mouth guards.
gotcha. Gotcha. Morning or night person? Which one are you?
Does it count if I'm trying to learn to be a morning person? Because I don't want my husband who walks past the room to laugh and hear me saying I'm a morning person. You know, you lying? I I always say the world is not created for night people, at least not with what we do, because we can't see patients at night. We see them through the day. So I am a recovering night owl.
Okay, that's fair. Fun fact, favorite color?
Pink.
Pink. Okay. Favorite food and drink, beverage?
So even though I'm Jamaican and they may pull my card, I don't know if you know that the game Black Cards Revoked. This might be a Jamaican card revoked. I love Mexican food.
Hey, that's
Love
because you have an
Mexican food.
appreciation for good flavors.
I love Spanish food. Cuban, Mexican. I love Spanish food.
Gotcha. As far as
And I
drink,
do love ginger beer. Hold on, let me catch back my Jamaican card. I love ginger beer,
okay, there's your drink. Okay.
especially Fever Tree ginger beer, because it doesn't have any high fructose corn syrup in there. That's
Got
bad
it.
for you, Doc. That's bad for you.
Hey, it is what it is. If that's your favorite, that's your favorite. What's your favorite place to visit or vacation to?
Ooh, so it used to be the Caribbean, but I didn't know what I didn't know, huh? So for our honeymoon, we went to Italy. Oh my gosh.
Ooh, nice.
Italy, the culture, I didn't realize, so I do speak some Spanish because I trained in the Bronx. We talk about where I trained. I trained at Montefiore Medical Center in the Bronx. At least I don't remember saying it. And they would say, "Mamita, doctora, no comprende español," because I guess I look Spanish. I look Dominican, I've been told. So they thought I was Spanish, and they would just come in and well, guess what? I started learning from the assistants. I started learning some Spanish. So I speak dental Spanish.
Yes,
I
yes,
can I can
dental
do a
Spanish.
thing in Spanish when it's pertaining to position and teeth and
Yeah,
healthcare instructions. So I started learning some Spanish, and it helped in Italy because I guess they call them, is it love languages or something like that?
love languages. Yes,
Italian words and Spanish words are ridiculously similar.
they
And my
are.
little Spanglish got us around in Italy, and it was just amazing. I loved, and a lot of people in Italy speak English.
Yeah,
So I really, really enjoyed that. And hopefully I can go back for one of my retreats. I can't wait to talk about my retreats, Doc.
there you go. Favorite thing to do when you're not in office or in clinic? What is that?
Oh, I guess I beat myself to it. So I think I made mention earlier that I applied to go back to do ortho. And part of that was because I burned out. Like I could not turn my head to the right like that. I couldn't raise my right arm. I'm right-handed. I couldn't raise it over my shoulder. Even doing that, I felt a little knot there. And what I know now was that I was experiencing burnout. My mental pain was manifesting itself physically. I was in a toxic work environment. I was in a toxic marriage. So when you have your work life was imbalanced and your home life was imbalanced, I mean, where was my rest? So now I learn that, well, one, I got out of my marriage, and two, I'm in such a more supportive work environment where I do have autonomy. I've never had one day somebody come and ask me, why did you do that? Because that this would have been more productive. Never have I ever had that question in the office where I work now. But I burned out. And now I founded Rejuve Wellness Retreats. It's short for Rejuvenate, where I teach. Right now it's women. I said later on I'm going to do some co-ed things because I've had a couple guys reach out. They're like, how come you're not doing anything for us? But I teach women how to focus on their PMS, and that's their physical, mental, and spiritual wellness. Because I find that I think you made mention earlier, I don't know if you saw me cringe. You were like, we have passion projects and we suffer, our self-care suffers. But if we don't fill our own soul, our whole bodies, if we're not filled, then we're showing up depleted. And I'm tired of showing up as the least favorite version of Trudy. I want to show up. Of course, it's not every day. I'm not going to be 8 hours of rest all day, every day, have my worship before work and my yoga, but doing little things, small incremental changes, even if it's one thing for 10, even 5 minutes, going on a walk during your lunch break can really help to reset you throughout that day. So I help doctors, healthcare professionals. Honestly, I help women. I've opened up our retreat to women to overcome burnout and the stressors and help to manage the stresses of life. So that is my passion project. I believe it's a part of my purpose. And I wish someone had taught me this stuff when I was down and out and I had nowhere to look but up.
Gotcha. Gotcha. So, time for some bonus questions. And if you all have been listening and watching all the way through, now here's your reward. I mean, she's been dropping some great tips and some advice and some great gems. Now for the bonus, some bonus things here. All right. One question related to tips for patients and some other tips for aspiring pediatric dentists of the future. And then another question about the dental profession. So next, bonus. So what are some of the common instructions or tips or oral health advice that you just commonly or always frequently are sharing with your patients and those and their families?
Yeah, I've got two for you. Uh, I would say one trick is to floss first, and I recommend doing it first because you're gonna brush. Most people brush, but they neglect the flossing. So if you do it first, I tell the kids floss it out and brush it away. So if you do it first, you're able to get to it, and then it's not a thing. And then the second thing is an acronym I created, PIC, P-I-C, non-sticky stuff. I think throughout this interview, I've reiterated meeting people where they are. So I try to meet our kiddos and our families where they are. We're going to eat sticky stuff. You asked me what my favorite drink was. I said ginger beer. That's sticky. It's acidic. Ugh. Pick non-sticky stuff. So popcorn, popsicles are okay. Ice cream is okay. Chocolate and cookies are fine. I've yet to find the K. A kid told me Kit Kat. What about Kit Kat? But I guess that's chocolate. So pick non-sticky stuff. We're gonna eat sugary stuff. At least pick the ones that are not sticky, and also drink plain water after you eat or after you drink sugary drinks. That helps reduce cavities.
Awesome. Awesome. For those aspiring dental students, that current dental students or even pre-dental students that may be looking into pediatric dentistry as a career, as a niche within the dental profession, what are 3 tips, knowing what you know now, that you would share with them to help them achieve their goal of becoming a board certified pediatric dentist? What are those 3 tips that you would want to share with them?
All right. Tip number 1, get a mentor, a coach. Dr. Darwin, what do you call yourself? The residence coach? It could be you, or it could be someone, go on the American Academy of Pediatric Dentistry website. They have a list of pediatric dentistry in the area, or if you know where you're going to practice, that's a good idea. Figure out where you're going to practice. Maybe even if you don't know exactly where, maybe top 3 areas, and try to reach out to maybe 3 dentists in that area and foster a relationship with them now. Say, hey, do you have some time to talk? And then during that conversation, come up with some questions for them and maintain that relationship. Yeah, a mentor and a coach is that friend that you need before you want to have that relationship established before you really in dire need, because sometimes it's not them, sometimes it's who they know too that can help you along your journey. The second tip would be, I guess it's an extension of that first tip. Once you foster those relationships, maybe try to shadow them and get some tips and tricks, especially before you go into residency. While you're in residency, great, or even after. But if you can foster those relationships early and shadow them, you can pick up tips from that shadowing experience that can help you even with how you treat patients. Because I call them tools. As pediatric dentists, we all have tools in our toolbox. At our office, we use lasers. So it does not replace our handpiece. But for those kids that are like, you're going to give me a shot and give me the drill, I'm like, look, it's a lightsaber. And then here I am. And they're like, oh, so we have little tips and tricks, and you can pick those things up. And then the last one would be patient with your patients now.
Be patient with your patients, not now, but right now.
Yesterday.
Right.
Yeah, because I think I said it earlier, like pediatric dentistry is definitely, it forces you to be a more patient person because you don't have a choice.
Yeah. And that's where also that emotional intelligence comes into play as well. You have to really empathize and also put yourself in that individual's mindset and their experience to try to understand what they are potentially going through, so that you can speak their language,
right?
Which will allow you to be a lot more patient with them. Great tips. Great tips. All right, so here's the question though. Here's the question for not only for those that are looking to be a dentist and be in the oral health profession, but also for us that are here in the profession 10 years, 20 years, 30 years, even 50 years into being part of oral health. If you could change one thing, about the dental profession, what would be and why? If you could change one thing about the dental profession right now that's going on.
If I could change one thing about our profession, Dr. Darwin, it would be the isolation that dentists tend to live in. I would recommend that each and every dentist become a part of a community. And I mean, community of dentists, community of hygienists. It doesn't have to be dentists. Things are just so isolated. The dentists want to be with the dentist. The hygienists want to be with the specialists want to be with their own specialty. I think having a more integrated community would not just benefit us as people, but it would benefit ultimately our patients. I feel like, I don't know if it starts in dental school, but we tend to practice in isolation, and no man is an island. I think you made reference to that earlier. And unfortunately, when you practice so isolated and you don't have anybody to talk to, a lot of times we struggle in silence, we suffer in silence, we're afraid to ask for help, which it that's help for us. Sometimes we're struggling mentally, but sometimes we're even struggling with some of the procedures. And I'll never forget, I did a tongue tie release. I actually talk about this. I show pictures in one of my lectures, and it just went south. The young man unfortunately got a liver clot. It was likely the most traumatic day of my entire dental career. And I literally had to call the local oral surgeon and ask him for direction. But we had already had a rapport built. So, he's talking to me. He's like, okay, this is what you do. I mean, I ended up sending him to the emergency room, but I needed help. And if we don't foster a community where we are supported, when things go wrong or when things go right, like, who do you share that with? And how do we become better as individuals? And how do we become a better more successful dental community? So I think we're too isolated. And I'm a general dentist and I don't talk to the general dentist up the street. Like, why? Look, every patient has a lot of teeth in their mouth. Some of them are missing, but there's more than enough teeth, more than enough people in this population that we can all serve. So, yeah.
Yeah, that's a great point. Having less of us within the
Competition.
profession. Yeah. Having less of us feeling like we're isolated, or just
Right.
naturally just isolating ourselves for whatever reasons, for whatever that source is, right? Not
Yeah.
comfortable asking for help, not comfortable being around other people, tired of being around other people, just want to do it our way. And that's it. I'm the boss now. I put all this time and energy and money and effort. I'm going to do it the way I want. I don't
Right.
need anyone else's external viewpoints. There's some of
Mhm.
that too. But to your
That's
point
true.
about an integrated community, that it has to start, like you said, not only within ourselves, but we also have to be willing to be integrate ourselves in other professions,
Yeah.
especially other health professions, because all the other health professions that serve people, most of those people have what?
Teeth.
Teeth.
But not just that, I didn't even think about that, but you're right. Or integrated in legal professions too. Because sometimes it's not when you get in trouble that you need help. Sometimes those attorneys can keep you out of trouble.
Yeah,
Um,
right. You need help on the front end, so you don't have to
right.
get help on the back end.
Yeah, so it's having a diverse community. My husband said it jokingly some years ago. It's since changed. But he was like, "What are all your friends' medical professions? We need a mechanic, we need some attorneys, we need no man is an island."
Yeah.
So integrating ourselves, stop isolating ourselves so much, get involved in um what is it called? Like ADA, like organized dentistry is the word I'm looking for.
Yeah.
Getting more involved in that, the
And
NDA, like
yeah.
so
And
that
and I
you
will
are
tell you
integrated.
that also can be a struggle for some people, because they feel like that, they have to pay to be integrated or integrate themselves into a community. However, you can still be a part of organized dentistry without social media currently right now that we didn't have 20 years ago. There's community on and within some of these Facebook pages, LinkedIn
That's true.
pages.
That's
So
true.
there's opportunities for us to join a community and be part of something bigger with other people,
Yeah.
in addition to joining organized dentistry as well, because even that's not for everybody for various reasons. However,
Yeah.
there's still opportunities for you to interact with and integrate with others in a similar type of
Through social
settings
media.
that
That's true.
are more uniquely constructed for you as an individual, right?
Yeah, that's true. I didn't even think about that. You're right.
Yeah, there's single mom groups, there's single practitioner women groups, guy groups, there's groups for endodontists, groups for pediatric dentists. There may even be groups for gray-haired dentists. I don't know. You know, there's so many different things that are out there that
I hope to not be a member of that group ever.
Well, you continue with your may get lucky and not have that transpire. But what has transpired over these last couple of minutes and several minutes is, you know, you sharing your answers to 32 questions with a pediatric dentist. And what projects are you currently working on that you want to share real quick?
That is my project. It's taken over my whole life, Doc. Like my wellness retreat. I have a wellness retreat coming up in Jamaica, March 7th through the 10th. And it's going to be amazing. It's for women right now. However, and you do not have to be a healthcare professional woman. But we're going to go down there and do some culturally immersive experiences, but also take some time to look inward and focus on self. We've got a yoga, sound bathing, and meditation instructor coming. We're going to journal. I mean, it's just going to be amazing. The villa is on the beach overlooking the water. I mean, if anybody wants to know more, I'm sure you'll put my information in the show notes. You can find me at Tiny Tooth Doc or Rejuv, REJUV, retreats.com. But I'd love to share more information because I will do that. Oh, we are doing that, but we'll do some local retreats as well. I'm in Atlanta.
Awesome. So we'll put that. Well, we just put that up right here, and that link, and also in the narrative as well. If you guys are interested, go hang out with Dr. Trudy and friends and others. You may even have some colleagues that you didn't even know were going to attend that are going to be there. So another way to build
community. How about that?
Build community. Ha ha. See how we did that. So how to build community, or actually build it and expand it. So people are not isolated, right? And are supported.
And we're not suffering in silence.
That's right. Or suffering and becoming sick as well.
I need to write that down.
But this has been a sick, as in very informative opportunity. Thanks so much for your sharing your answers to 32 questions with a board certified pediatric dentist. Guys, go to the next video right now. Go to the next video. Love, peace, and smiles. Go to the next video. Go, go, go.